Okay, welcome back to Bio 461, Exam 3, Essay 1. This time I'm going to talk about the EKG, specifically what the P, QRS, and T waves are in an EKG reading. And I'm also going to go over some abnormalities, specifically the NSTEMI and the STEMI, which get kind of crazy and interesting. But to begin, I'm going to give you a basic idea of what an EKG is and how it is read. So an EKG is essentially a graph that cardiologists and doctors and healthcare providers use to monitor a patient's heart rate. And so I'm going to go ahead and draw a graph. And essentially what we see in a heartbeat, if you haven't seen a heartbeat before, it's going to look something like this, right? So we've got this going on, and that's just going to repeat over and over again. So, but these waves do not go without meaning. They need to have some meaning to it. So what's happening is each wave is assigned a letter, and each wave is representing what is happening to parts of the heart while it beats. So to begin, we have our P wave, which I'm going to go ahead and draw heart. That was a terrible heart, so I'm going to redraw that. Okay, pretend this is a heart. And so now, basically the heart has 4 chambers. It's got the right atrium, left ventricle, and the right ventricle. Just some basic anatomy for you. And they're all going to play a role in this heartbeat. So to begin, we have our P wave, and what these charges represent are they're how the heart is going to depolarize and repolarize over time. So our P wave is when we're going to start depolarizing our atrium. So this whole section of the heart is going to get depolarized in the P wave. So I will write that down. Depolarization of atria. And that depolarization happens through a structure known as the SA node, and that is also known as the pacemaker. So it's basically making the pace of the heartbeat. So we want to remember that the SA node is what causes this contraction to happen. Another node that we need to know is called the AV node, also known as the atrioventricular node. And what's happening is this is going to be a major player in the QRS complex. So once the signal hits the AV node, it is going to cause depolarization down the ventricular septum, which I forgot to point out, it's going to be this area right here that I will shade in red. So this is our septa. So what's happening is we're going to depolarize, and it's going to start on the left side, and it's going to depolarize from left to right. So basically when we're depolarizing the heart, we're going to create lots of vectors going in one specific direction, and then pretty soon it's going to have to depolarize towards the right side, and that's going to create a vector going from right to left. And because when we depolarize, I'll quickly show you what's happening. So pretend these are the charges of a cell. When we depolarize, these charges on the outside of the cell are going to become negative, and the charges on the inside are going to become positive. So when this part gets depolarized, there's going to be negative charge on the ventricular septum, on the outside of the ventricular septal cells. And when we draw the vector, we are going to say that we are going from a negative tail because it is going from negative charges, and it's going to point towards this negative charge up here. and that's what's going to cause a downward wave. So anytime you go from the same charge, that's going to cause a downward wave. And this is going to be very important to know when I explain non-STEMI and STEMI. However, when it goes in, whenever it's going to go towards an opposite charge, that's going to be expressed as upward. So when I went from its negative charge, the average vector was going this way towards the positive charge, that's going to cause our wave to go up, and that's why our P wave is up. But with the Q wave, our vector is going to be pointed towards that way, which is going to create an angle going towards the negative charge, and that's why it's down. The next thing that's going to happen is, now that this is depolarized, our whole ventricular septum, specifically the inferior septum, is now going to be depolarized, and that's when we have our R wave. Oops. So our R wave equals depolarization of inferior ventricle. So basically, the whole, or almost the entire heart, is going to be depolarized except for one piece, which I'll explain in just a second. This one piece now is going to contribute to our S wave, and that's going to be the depolarization of the left lateral ventricular wall. So this is the last piece that gets depolarized. Once again, because we have negative charge going this way, our overall angle is going to be more pointed towards the negative charge, which is why we're going to have a downward wave. And then last but not least, we have our T wave. And the T wave is special because that's where we're going to start our relaxation, and that's going to begin in the apex of the heart, which is located here. We are going to begin by, now we are going to repolarize the heart, meaning we're going to let the outside of the cell become positive. So we're going to start repolarizing the ventricles. And it's basically going to happen in the same, or in the opposite order that the depolarization happened. So another thing we need to remember is the order of repolarization is going to be from the apex to the epicardium, and then finally to the endocardium. And that's what's going to happen in a regular EKG. Now I'm going to go ahead and explain NSTEMI and STEMI. So I'm going to go ahead and erase all of this. And I'm going to draw another heart. Okay, so once again, this is our atrium. These are our ventricles. We've got our negative node here and our positive node here. Now what's happening in NSTEMI is we are essentially going to have hypoxic cells in the endocardium. So I will go ahead and label that. And those hypoxic cells are going to have a negative charge on the outside. So pretend this whole clump is representing hypoxic cells. What does that do to the EKG? It's going to change it very drastically. Specifically, it's going to change how the SA or the S wave is written out, and it's also going to change the baseline, because the reason for that is because when the EKG is reading the heartbeat and we've got hypoxic cells in the way, it's going to read it it's going to read it in such a way that the EKG line is going to be raised. So say this is our normal level. Now our EKG level is raised up here. In an NSTEMI, which I will indicate, that stands for non-STEMI non-transmural, let's see, non-systemic, non-ST elevated myocardial infarction. So our P wave is going to be the same because nothing happens in the atria. Our Q and R wave are going to be the same. So I'm going to go ahead and let the heart be depolarized like it normally is. But then once we hit the S wave, that's where things get interesting. So by the time we hit the S wave, pretty much the whole heart is depolarized except for that one corner, and that's where we are no longer going to see a dipole in the reading, and so the EKG is going to read that as being at the baseline again. And so our S wave is going to come all the way down to our original line, and then our T wave is going to come back up because when we repolarize the heart, it's going to detect a dipole again. So now we have our new ST wave. We call that our ST depression because our S wave is a lot lower than our baseline, and then our T wave is going to come back up. In STEMI, however, that's going to look a little bit different. STEMI stands for ST elevated. So in other words, ST meaning the line, ST elevated myocardial infarction. So now, let's say we have this whole ventricular wall covered with hypoxic cells. The EKG is now detecting that as we have vectors going this way, vectors coming this way. So now we have an average vector going out towards the negative charge, and that's going to lower our EKG chart. And I failed to mention in non-STEMI, it's the opposite. So we have our negative charge going to positive, but in this case, our vector is going to negative. So that's why our baseline lowers. Once again, the P wave and the Q and R wave are going to be the same. The S wave, however, is going to be the same way where it doesn't detect a dipole. So it's going to hit the baseline, but then come back down on the T wave. And so it's going to look something like this. And we call this ST elevation because our S wave is a lot higher than our T wave. But STEMI is extremely life-threatening compared to non-STEMI, and inevitably this could lead to patient's death. And that will conclude my discussion on EKGs.